I'd like to give a shout out to our newest sponsor, Solutions Today Supplemental Insurance. If you're a competitor in the cage, in the boxing ring, put your body on the line every time you compete, you can get cut, you could break a leg, a finger, who knows, put you out of work. It sucks. They'll provide you with 24/7, 365 days a year supplemental insurance covering everything from hospital stays, fractures, outpatient surgery, recovery benefits, family plans, and more. They pay out in addition to all other insurance, including WSIB, employment insurance, and your work benefits. Qualification is easy. No medical test or exam needed. No occupational restrictions, and no income verification. Head on over to solutionstoday.ca and get coverage for you and your family.
It all works.
Yeah, so he was in yesterday. And it was super informative. Most of it was questions myself, because I was like, man, like I have night shift, I don't get enough sleep. My nutrition isn't greatest because I'm lack of sleep, so I'm craving sugars more. And he's like, it all comes in. It's all about gut health, really. The grand scheme of things I got from it was you can't absorb all these good nutrients if your gut isn't ready to absorb those nutrients. It was just really, really cool. We're good to go. Okay, we've been running. Yeah, awesome. So we don't really. Okay, so we'll get started. I'm glad you guys made it. I just want to get that set here. Okay, so today, welcome to Studio 88. Today, my special guest, I have a bunch of special guests today. Dr. Lauren Karatanevski and Dr. Kyle Ruiter. Dr. Kyle Ruiter works with Vox Neuro, which is a neurological team who does assessments on
brain health. So we do cognitive health assessments.
And Dr. Lauren will call her today, and so I don't have to struggle through that. She does Back-In-Action, which is after they scan the brains, you're the one who does the rehabilitation. Yep. And then we have the one and only King Faisal Rehman. Everybody, on my listening viewers, everybody knows King. King is a huge component to the fight community. There isn't a fighter in the province that owes Faisal something. We're all indebted to him because he does so much for the fighters and the athletes. So he's joined us on the podcast today because I'm not the smartest guy in the room. So ultimately he'll be the one to kind of help break down things. So just a little bit of backstory. Lauren had reached out to me on our AMMAO website, which is Amateur Mixed Martial Arts Ontario, which I'm the president of. And basically it was kind of to bridge the gap between the fighters and your neurological team and rehabilitation team. When I got the email, I was immediately intrigued because concussions are a huge problem in our sport. And we have to speak for the fighters. They don't protect themselves. We kind of have to protect them. So after a few phone calls with Dr. Lauren, I was very happy with the way your approach to things were. It wasn't a business scam. It wasn't and that's kind of why I brought Faisal on board too, because Faisal is our medical director basically, and he helps us with all the medical mumbo jumbo stuff that gets us through our daily day. And in a nutshell, it was him that was to sift through all the bullshit, we'll call it. And there was no bullshit. It's legit. It's what you guys do is really good for our community. And what you guys do is great because concussions are always a thing that they will always be. We don't know the full side effects of everything because it's still an ongoing learning process. So in a nutshell, we'll kind of dive into this thing, and we might be a little bit all over the place, but in the end, we'll kind of tie everything together. It'll still work. So Kyle, let's in a nutshell, if a fighter comes to see you and they go through your program, how does all of this work?
Yeah, for sure. So essentially, let's say a fighter sustains a concussion. They will come in to Back-In-Action, one of our certified clinics, and they will have the Vox Neuro cognitive health assessment conducted. So this is a neuroimaging test that leverages EEG. So it's a little different than traditional EEG. Traditional EEG or clinical EEG is used more for looking at seizure activity and measures kind of that resting state activity of your brain. What we do is we provide more of a kind of a stress test for your brain. So we look at different types of cognitive functions such as working memory, attention, and concentration. And we measure these by having the the athletes perform a test, perform a test while they are simultaneously being recorded through the EEG. And so what responses come out of that EEG from how they do the test are reflective of how well they are performing those cognitive functions. So there's a few different ones that we measure, and then from what we measure, then the clinicians, at Back-In-Action or otherwise, are able to then pinpoint where is this deficit happening in this individual, and how can they start their rehabilitation program and help to inform and accelerate their treatment program.
Okay, so I'm gonna have a question for Faisal real quick. So so all the fighters have to go through extensive medicals before they get licensed to fight. That's how it works in Ontario, and usually it's a lot of states and provinces, they do the exact same thing. In order to get your license, we do EEGs, MRIs, CAT scans, and stuff like that. How is their EEG any different from what the fighters do currently?
I think what's really fascinating about the Vox Neuro program is they're measuring the response of the EEG waveform to a variety of different stimuli. So when you get an EEG for licensing, it's really just a resting EEG. And just to explain to your audience, an EEG is really measuring the electrical activity in the brain. We're measuring the brain waves we put electrodes on the head and we look at the electrical activity within the brain. And we can sometimes pick up seizure activity. People with epilepsy have abnormal EEGs. That would be probably the most common place we use EEGs. But we use it for licensing because we're trying to identify if there's any signs of brain trauma. So you do an anatomic assessment with an MRI. You do an assessment of their brain activity with an EEG, and then you do a neurologic exam as part of your physical exam to see if they have any deficits clinically. And the resting EEG is very limited. We're not required to do evoked potentials where we shine lights in their eyes and see what happens. We don't require them to do any tasks.
And that's what you guys do, correct?
Yeah, more similarly, yeah, exactly.
Okay.
Yeah. Okay. So we just get a resting EEG and make sure that there's no abnormalities. If there is an abnormality, then we have to get a neurological assessment as a brain specialist to see the patient. But what I like about the Vox Neuro program is they're looking at the evoked potentials that you can see on an EEG tracing and seeing how they respond to tasks. And I'm sure Kyle will take us through what those tasks are, but drawing something or saying something or doing a memory task. And seeing if how that EEG changes, that's fascinating to me. And I'm not an expert, I'm just I'm a kidney doctor who fights. and so I think I like that stress test. We do stress tests on the heart. Why can't we do stress tests on the brain?
Which is the most
So
important
it immediately
part.
got my attention when he explained that to me, and so I thought that was really cool. What we have available now for our athletes for concussion diagnosis management or brain function assessment is very limited. So I was super interested to learn about Vox Neuro.
Absolutely. So Cody Kent, he's a professional fighter here in the province. When Lauren and I had discussed all the process on how everything works, I suggested Cody Kent. The reason being is the last event in Toronto, he was supposed to fight on. He got nailed with a concussion in sparring. And unfortunately, it happens in the sport. Guys pull from fights all the time because of concussions. And for the most part, with a little bit of rest and recovery, they bounce right back. I suggested him to come in to actually see you guys, to kind of understand how it all worked. Because when you explain it to me, I can sort of understand it, but it's to actually have someone to run through the whole program and then pick his brain after on like how was it. He did tell me, he goes, it was a long day. He goes, but he reiterated that you guys were filming, and so you guys were documenting everything. So run us through the tests on the things that he did from start to back.
For sure. Do you want to start? Want me to start with the Vox Neuro side of things?
You start with Vox Neuro and then
Sure.
I'll complete it.
Okay, cool. So from the Vox Neuro side, we had him come in. So he ran through our entire test battery, our test program. So there's 4 tests that we have them run through. So, and these tests, like I mentioned before, we measure 2 types of attention. We measure concentration, working memory, and language comprehension. So for an example, one of the tests that we do, it's a neurological assessment that's been adapted for EEG to be measured simultaneously with it. So what we do is it's called the continuous visual memory test, or the CVMT. And all it is differentiating between images that you've seen before and new images. And we're having them, it's a simple task. They have a button box in front of them. They click 1, they've seen it before, or you click 2 and they haven't seen it before. So what we're more concerned with is not so much the behavioral part of it, but that they're paying attention and they're actually taking in that stimuli. And it's those stimuli that when presented to them is what Dr. Rehman was talking about, is that we measure the electrical activity that occurs when the stimulus is presented to them. And so then what we do is we take that information and we compare that individual athlete to our large normative database of individuals who have not sustained a concussion in their past. So like neurologically healthy individuals, right? And then we also, to be more sensitive, we actually also compare them to our database of those who've had sustained a concussion. So we're able to actually pinpoint, precisely, are they in that normal range for somebody who's, had an injury, or are they more in the range of people who have sustained a concussion in the past? So that's what we do kind of on the back end to, be able to determine where this individual is relative to their age-matched cohort. Right. So we run them through 4 tests. Another one that we do is essentially they listen to auditory beeps and tones. Some are different than others. We have them differentiate between them. The language comprehension one is, again, a neuropsychological adapted test. It's called the Picture P Body Vocabulary Test, or the PPVT. And all this is really picture word matching. They hear a word and they see an image. Does it match or does it not match? And you click a button otherwise. But it's really just to make sure that the athlete is paying attention to the task at hand so that we can measure how well they are performing functionally. And this test in total takes about 45 minutes. And then after that, the report goes back to them 2 days later after we've done an hour analysis on our end. And then it's the clinicians such as Lauren who then take this information, take the report, and then, like I said before, kind of customize and make a tailored treatment plan for these athletes.
Okay, and that's where you come in.
That's where I come in.
Okay, so the assessment is done on the athlete, and then you take a report and you say, okay, this is what's wrong. This is where he's not fully up to speed, or he or she, and then they come and see you.
Yep.
And and then what do you do from there?
So what happens is I gather that information from the report that we get back. In that report, it distinguishes the athlete or the person who comes in with the head trauma as normal and there's nothing wrong, a moderate deficiency or a severe deficiency. So we take a look at where those deficiencies are, and then we have in our clinic, not only are we concussion management certified, but we also have someone who specializes in cognitive rehabilitation. So we turn around and take that individual and say, you're severely deficient, let's say, for example, in concentration. So we're now going to work on rehabbing you in that realm of concentration. So we may have them on a treadmill where they're walking on a treadmill. And we had this actually with Cody, and he said that this was one of the more challenging tasks. But he said that we would have him on a treadmill. He's walking on the treadmill and we're flipping Uno cards that he has to remember. And he has to remember whether or not he saw that card previously. And if he did, he says yes. And if he didn't, we just continue going. And so that is an example of something that we would do. And of course, it would be more periodized. It wouldn't be that difficult right from the get-go. But there's going to be a bunch of different things tailored to that specific individual that we would use as rehabilitation from that cognitive standpoint. But then we also delve a little bit further because of our knowledge in concussion. We also kind of marry the concussion management that we do at the same time and look at more of a holistic approach to caring for that particular individual.
Okay, so when you say holistic approach, so no medicine, no drugs.
No drugs.
Just straight rehabilitation through...
Rehabilitation from our standpoint of things. At our clinic, we have a lengthy process that we like to take the patient through. So we not only have our concussion protocols that we go through, and we have then our cognitive rehab through our partnership with Vox Neuro, but we also have other checkpoints that we like to take a look at. We like to take a look at how their sleep hygiene is. We like to take a look at what their nutrition is like. Are they on any kind of medication? Do they maybe have to get medicated? And so we really start to branch out at that point. And when I say holistic, I mean we take a look at every avenue that we possibly can take a look at and create a team of practitioners to help that athlete or, again, that person get better.
So it's not only athletes you deal with with like car accident victims or so anyone really with head trauma.
Anybody with head trauma from that concussion standpoint of things. But what I really love about the whole Vox Neuro program is it's not just head trauma. And Kyle will definitely speak better to this, but we were discussing, post-traumatic stress. If that person is stressed for a chronic period of time, a period of longer than 3 months, let's say, there is going to be some sort of cognitive ramifications to the fact that they've been that stressed for that long. So it's not just head trauma that the Vox Neuro program and our testing through the cognitive health assessments can really administer and see if there's any kind of deficits, but it's a whole plethora of people that we can really take a look at. So we focus on concussions because that's what we love to do in our office. And that's why we partnered with Vox Neuro, is because for us, there was a huge gap on the cognitive side of things. We can get them better physically. And like you were saying, Jamie, like, yeah, some of the athletes would rest, they would feel better, they can go back and fight. But what we were finding at our office was we can get them to that point, but then they were still complaining of memory problems. They were still complaining of concentration problems. And we didn't have that test that we could administer until we met the Vox Neuro team to help them with that kind of the cognitive side of things.
Wow. What kind of results have you seen with patients in the past?
Well, this is very new to us in our office now. But I can say from the feedback that I've gotten from my physiotherapist that does a lot of the cognitive rehab, patients are already starting to feel better, which is great. And it's more of a motor vehicle accident population that we've seen from this standpoint. But they're turning around and saying to us that they do feel that they have more energy. Their headaches have diminished. They can concentrate better. Their memory is getting better. And so it's nice that we're getting that subjective feedback from that objective data that we got. And I think it's that objective data that allows us to tailor such a perfect program for that individual. Because if we're just going on a subjective analysis, we're shooting in the dark. Someone tells us that they have a headache, but we really don't know what that means, because everybody has a different description of what a headache may feel like to them or what their concentration deficits may be. So we can turn around and say, yeah, you have a problem here. You have a deficit here. Let's work on that. And then you provide us the feedback. And it's been great. It's been really good.
Okay. What are the telltale signs of concussions? There's some now, I'm sure there's a whole list of them. You guys smile because like, oh man, here we go. But some guys may not even know they've had a concussion because of their fighters, for example. Some guys just think they got their bell rung in the ring, say, all right, I'll just rest for the day and I'll go back again at it tomorrow. And then the progressive concussions is what makes them generally worse. What was something that an athlete should be looking for when it comes to concussions?
You're absolutely right. There are a bunch of symptoms that we have to look for. Scott, my husband, speaks better to this, and we maybe have to jump him on so he can actually explain the concussion, what a concussion is. But signs and symptoms of a concussion, you don't actually have to get your head hit to have a concussion. So it's an acceleration and deceleration of the brain in the skull. And it's a tethering of the nerves that are providing the feedback to the brain. And it's a depolarization of those nerves. So he would probably explain it better, in less scientific terms than me. But I'll give you an example of certain signs and what symptoms we look for. Headaches, neck pain, dizziness, nausea, sensitivity to light, sensitivity to sound, not feeling right, not feeling like themselves, irritability. So there's such a wide variety of things in terms of symptoms that we look for, that it's not just, oh, I got my head hit and now I have a concussion. We do really look for all those signs. And if they do present with those signs, it's a matter of, the way that I like to tell my patients is I like to say that we got to call it a concussion until we can prove otherwise. Because from a liability perspective, we know what happens in sport now. Sometimes these concussions go unnoticed. You worry about the long-term side effects of them. And I much rather, from a personal perspective, turn around and say, let's call it what it is, and then we'll figure out from there if it's not. Because something very similar to whiplash. Whiplash presents itself almost identically to a concussion does. But I don't want to call an athlete, I don't want to turn around and say, oh, it's just whiplash if they present with all these symptoms. And then we have them go into the ring sooner, and then something happens, and then we actually get into the realm of what we call a second impact syndrome, which is the concussion never healing to begin with in the first place, and then they become concussed again. The long-term ramifications of that are unknown, variable, and serious. And so I would much rather, the way that I do it, I say, let's call it what it is, and then we'll figure out from there and go from there.
Now, with your program, can you identify CTE?
So CTE is strictly just post-mortem today. So this is looking at specific proteins in the brain after death and looking at and measuring that. So what we're looking to do, at Vox Neuro is try to enable us to have, measure, fighters, other athletes, and anyone who's had any kind of trauma today, follow them throughout their careers, throughout their lives. And then when they do eventually pass, then are we able to create kind of almost a biomarker essentially of, if this is kind of where this individual is today based on their cognitive profile, and they, once they passed, did show signs of CTE, are we able then to help those who are falling into that similar cognitive profile and try to help them and not get to that point? So, of course, this is all theory at the moment, and that's what we're looking into. But that's really kind of the future of what Vox Neuro wants to get into, of just making sure, it's brain health across the way, across everything. And with CTE, it's a big one. A lot of athletes show it, but a lot of athletes don't show it. People have had serious head trauma. And so why is that? Why do some show it and some not? And that's still just speculation at this point. We don't know. But I think with what we have at Vox Neuro, it can be a step in the right direction, but it'll take time till we get to that point. But it's a great question.
Because I remember back in the day, you got hit in the head and your mom would wake you up every half an hour. And the things have changed so much now that they're encouraging rest. Sleep is actually a good thing for people with concussion. So it's amazing to see how much it's changing, and that's why it's ever evolving. We don't know enough about concussions to. Fighter jet just went by. We don't know enough, right? So that's I'm actually super happy that you guys are tackling this on to better guys. I don't want to see a guy lose his career because of a concussion. I like to see him get back healthy. He's good, and then to continue on with his career, because for most guys, this is all they have.
Yeah, I think that's a really good point that you bring up, is we're not trying at all to advocate people shouldn't be doing what they love to do. What we're advocating for is better brain health management. We want to help those continue to do what they want to do and make sure they're healthy as possible while doing it and afterwards, because, the facts are solid. We know you can have pretty serious neurological damage post, a professional career in sports, whether it is MMA, whether it's football. I've done a lot of research in football, professional football players. But the point is, we want to make sure, how can we help these athletes continue to do what they love to do? This is their livelihood, as you said, and be, just be that brain health management component. That's really what we want to focus on, and make sure that, they can get back to doing what they love to do and not have the long-term ramifications.
Okay. Yeah, and to your point and to Kyle's point, Jamie, what is out there in research is ever evolving. Like you were saying about the rest. Now they're talking about that, you want to make sure that you may have some light activity. So it may not be absolute rest anymore. Whereas where we thought that it was absolute rest, stay in a dark room, shut off all the lights, don't do anything. Now the research is changing to show that, maybe it's more of a light activity, relative rest. Remove yourself from the things that trigger you, but don't be in a dark room anymore. So, and the nice part about, what we were talking about is it's always staying on the forefront of what's presenting itself. And fortunately, in situations like ours, because we're so heavy in concussion management and now we're doing the cognitive health assessments, we're always on top of the research of it all. I can't say that for a lot of other clinics that I know. I can't say that, and it kind of makes sense though. You get wrapped up in the things that you're doing. You're not always going to necessarily follow the latest research that's out there, but we're really happy in the realm that we're in because we do get research articles sent to us every month. So we're always staying on top of what's the most current. And then we've been able to find organizations like Vox Neuro to just amplify and make that technology so much better to help these athletes out. And I get it. I was a professional. I was an Olympic level springboard diver. My husband was a world fastball pitcher. We understand sport. We understand athletes. We understand the psychology of it. We understand the training of it. And we just want to be able to give back as much as we can in a different way. I may not be able to give back as a springboard diver. Springboard diving and MMA fighting could not be further apart from one another. But, to be able to help these athletes, I know what it feels to be injured. And I know that, it's really shitty. You know, you want to be able to get out there. You want to be able to fight. And we want to be able to make sure that they do it in the safest way possible.
Yeah, and I don't want to try to jump on and ask a question, but I'm really curious of King's point of view. Like, what is done today if someone, you know, goes in to the ER or goes into a clinic today from a concussion standpoint?
Thank you. That's excellent. So I can speak to our own center here that it's very limited. And I think to delve into something you were asking, a concussion is a brain injury. And I think that's what we have to tell our athletes. When you've sustained a concussion, your brain has been injured. I don't care if your MRI is normal and your EEG is normal. You have a brain injury, and we need to treat it as best we can. And what's frustrating to me as a physician who's not a concussion expert is there seems to be a lack of stuff or places to send our patients. We have a concussion clinic at the Fowler Kennedy Clinic, and I've sent athletes there. And sometimes I feel, you know, I could have done that management without having sent them there. I mean, so we're not getting any sort of specialized treatment that's altering the progression of the athlete's concussion. And that's very frustrating when they have severe post-concussion syndrome and they're delving into depression, suicidal ideation. They can't leave the home anymore. Horrible nightmares. You know, so it's very, very frustrating to see that. And as you kind of mentioned, like our what we're doing changes over time. You know, sensory deprivation, no sensory deprivation, some activity, not too much activity. And I think, you know, you guys are on top of the research more than I am, but it's an ever evolving field. And as you mentioned, everyone's individual concussion experience is different. And so how do you alter the treatment? How do you do a randomized controlled trial in concussions when everyone presents differently and recovers differently? So there's not a lot of great evidence for how to manage concussions, I think. And what I like about what you guys are doing is at least we're starting to explore that. We're doing clinical trials where we're doing using new technologies to try and pinpoint deficits in athletes' performance and tailoring treatment to that. And I'm hoping you guys will have a database eventually that we can use to answer some of these important clinical questions, because I know you guys are saying concussion management and getting the athletes back to what they love to do. I think we need to tell people when to pull the plug too, because there's 100%. Too many times we've sent athletes back in, and I'm seeing the results of guys who fought for 30, 40 years now who are violent, who are severely depressed, and it's because we didn't pull the plug. They had one fight too many. So although I agree we want the athletes to be doing what they know they love, we need to know when to pull the plug.
Well, we have to protect them. Yeah, I mean, the end of the day, when and Faisal has been known for this too. You know, Faisal, don't fight. No. You can't tell a fighter that they shouldn't fight or that they can't fight, and that's the hardest conversation to ever have with an athlete, is to say, like, man, I think you should kind of like pack it in. Try something else. It's the worst conversation to have. It's the hardest conversation to have. And I've had conversations like this with Faisal, because Faisal's a fighter. He's not only a doctor, he fights. He's fought for me numerous times. And a lot of times you're like, why are you fighting? You don't have to fight. You're like, you can't tell somebody that. But on a medical standpoint, when you present the facts and you present the evidence and you say, look, it's time to pack it in. Instead of somebody giving their own opinion of somebody, I mean, I can opinion somebody all day and say, listen, you know, don't fight anymore. It's not good for you. But if we can clinically say, look, listen, like, one more hit, you're toast, or if we can present that to them and as a preventative, 100% I'm all for it. Otherwise, really, I think what you guys do is bridging the gap between the athletes and yourselves and coaches. And I think people should look at this more importantly, because they don't and they won't. Just as a fighter, they just want to go in. They just want to showcase what they do. They're wired differently than you or I, right? So,
and I think one of the things we had talked about earlier actually is the advantage of your technology and your clinic is perhaps I'm not sure comparing concussion patients to non-concussion patients or is maybe as helpful as the variation within the individual athlete. So I know that it doesn't happen now, but I wonder if there is a way for high-risk athletes to longitudinally be followed with Vox Neuro assessments or concussion assessments and see how they change over time as their career progresses.
Yeah.
Because that may be more meaningful to say, you know what, you used to be able to do this cognitive skill way more efficiently in a timely fashion, and your cognitive score has gone down by 30%, which is way more than what we'd expect for your normal aging process. I think it's time to, think of a different career, or we need to investigate this further with more medical tests.
Yeah, I mean, that's really useful. Yeah, and that's precisely it. That is what we're doing today. We do that not just with athletes. We do that with anyone who comes in with any sort of head trauma. We follow them along that rehabilitation process and are able to objectively identify, are they improving through their rehabs or are they not improving through their rehabs? And like I mentioned before, we always will compare to that normative database, because I think it's important to know, like, where is that individual relative to where they, like you said, where their natural aging progression in terms of cognitive ability. I think that's super important. But as we test them time over time, we also compare them, just the individual in between, like, their different test scores, right? So we can objectively see at the neurological level, are they improving? Are they not improving? Have they gotten to that point where, is it their baseline? Is this where they're always going to be? Because people who obviously hit their head for a living are going to be at a different cognitive rate than people who don't. That's just the reality. But how close can they get to what is that normal level? Are they back to what is their normal level, right? What are those baselines? So absolutely. What's so great about our technology is the fact that, we can provide baselines for those who expect to go out and get a concussion, like MMA fighters. But not everyone does. The average person doesn't expect to go outside and hit their head today. So what do you do with those people? And those are the people that we really want to make sure that we can compare to what is someone, your age supposed to look like.
To complicate things further, many people who are attracted to or join boxing or join combat sports are kids who suffer from things that make them socially isolated, like autism or attention deficit hyperactivity disorder. And so they're drawn to boxing often because it gives them confidence. It gives them, and their parents bring them in wanting to learn that sport for that reason. And so when you do let's say a Vox Neuro assessment on someone with that baseline, to compare that to someone who doesn't have those cognitive disorders, I think it would not be doing service to the athlete. So that's again where I see the longitudinal follow-up being more meaningful than
it's a great point. With our, sorry, I didn't mean to interrupt you there. Is that today we are measuring cognitive function inclusive of all variables. That could be individuals who are diagnosed with ADHD or depression, other mental health disorders. So the future of Vox Neuro, as we are able to collect more data of these individuals, of all these different cognitive profiles, is the ability to disentangle, is this really a result of your concussion, or is this really a result of, your depression? What is it? So today we're not there, but as we grow, that is the future of Vox Neuro, and that's the goal of what we want to do. But you make a great point. Somebody who goes in, everyone's going to have a little bit different cognitive ability depending on what their own mental health ability is, if they've been diagnosed with ADHD or whatnot. So to your point, it's exactly right. We want to be able to, follow them, not both compare to that normative database, what the average is for someone who doesn't, but also be able to follow them over time. And eventually we'll be able to have enough data to go, okay, this is what an 11-year-old who has ADHD typically looks like, because we have enough of those 11-year-olds who have ADHD, right? So that's what we're going towards today. Not yet, but that's ultimately the goal. But that's an absolutely great point.
So I can ask a
question?
Right now, if the commissioner, because I work with the sports commissioner, Ruiter, for combat sports, if he contacts me and says, this athlete has been has been knocked out multiple times, is showing signs of cognitive deficits, can you examine him? And we examine him, and in order for him to be cleared to fight, he needs to get through me. And if I'm not certain, based on my assessment of what's happening to him cognitively, or from a head trauma perspective, I have him seen by a neurologist or a neurosurgeon. I MRI his brain, do an EEG, and then perhaps we do neuropsychological testing. And the neuropsychological testing can cost $1,500 to $2,000. So as an athlete who wants to protect his brain, if I'm an individual athlete and I'm looking to do this, I'm going to be interested in longitudinal follow-up. I'm not going to be interested in a one-time test where you say he's not bad, he can fight again, and then I get knocked out again, and then maybe I see you, maybe I don't. So to have that proper longitudinal care in a concussion clinic with, let's say, a Vox Neuro assessment, how does someone afford that, and what are the costs associated with it? Because a lot of our athletes, we want them to have access to these types of treatments, but it needs to be something they can afford.
Yeah, absolutely. I mean, I'll let Lauren speak to it, but first I'll just say it's significantly less than a neuropsychological assessment is the first thing that I will say, but I'll let Lauren speak to the costing structure that they have at their clinic.
In our clinic in particular, the cost for the cognitive health assessment is $650 plus HST. But we, making sure that we want to make this as feasible as possible. We don't want the price to deter away from the athlete getting testing like this. So we have gone to ask insurance companies whether or not a part of the assessment can be covered either under chiropractic or physiotherapy, under occupational therapy. So we will do everything on our end to see how much coverage there can be, if there is any kind of extended healthcare coverage for that particular athlete. We've also looked at other ways that we can try to make it more feasible for them. There's payment plan options with a specific company that we work with, where that company will pay for the assessment, and then that athlete will then have a payment plan with that company. Again, we don't want to deter in any way, shape, or form. We want to be able to have this assessment available to them. So any way that we can work through it, we will definitely try to do that. But again, like I was saying, there's different options that we can use. If they do have that coverage, we can put it through their coverage. So some or all of it can be covered through their extended healthcare.
What about their longitudinal follow-up, though?
Follow-up would be the same thing. At that point in time, particularly in our office, I would try to see if there was a way that we could work with the insurance companies to have them be retested. I know it's going to be case dependent. It's going to be insurance company dependent. So for that follow-up, we don't have anything yet in place. It's still going to be that $650 plus the HST. But my hope is that if we have more people do this, the insurance companies will get to understand that this is what we're doing.
And aside, the Vox Neuro assessment aside, what about follow-up to see if what the plan you've created for them is helping? So let's say I've had a horrible concussion, I've got post-concussion syndrome. You operationalize a plan for me, and I want to be seen again, or you want to see me again in 1 month. What does that look like for the athlete?
That for us would just be a follow-up appointment. So again, if they have that coverage available to them, that would be either billed as a chiropractic treatment, a physiotherapy treatment, an occupational therapy treatment, and that would just be billed to their insurance company.
How much is that?
At our office for an
Roughly.
adult, so to speak, so anybody between the ages of 18 and 65, it's $70 a half an hour session. And then for our more younger population, below 18 and then above 65, we're at $60 a half an hour treatment.
I think those rates are very reasonable. I just and a number of our athletes will have some form of coverage, which will help. But also a number of our athletes are unemployed or live below the poverty line.
A lot of these guys do the fighting to make.
And they're making less than $650 for the fight sometimes.
Sometimes,
and certainly not in Jamie's promotion, but in some promotions they're literally being paid $100 or $200. Mm-hmm. So that can be an issue. So it's not a challenge I put out to you that I think if we need to reach more patients and we need to make sure that they take advantage of this technology that we have and of your clinic, we need to do some work on improving accessibility. Mm-hmm. Whether that means charitable work, or it means, even in the U.S., very successful private surgical practices will charge the wealthy exorbitant amounts and then help other people for free. So we need to look at some models of care, because for our athletes to be able to benefit, we need to have different ways to access the treatment, and especially when $650 is not something they can afford.
Yeah, I think, and that's just a conversation that really can be had with the commission. I think some sort of understanding agreement can be come to, right? So I think that's kind of would be the next step of how can we make this more accessible to everybody.
Now, and a quick question, commission related. Would this be something that could take place of the medical process with the fighters?
Absolutely no. The government moves very slowly.
Yeah.
But I would be in favor of changing everything that we're doing now to follow up patients with concussions. I mean, as I mentioned to you earlier, if it's a bad concussion and they're severely symptomatic, they have to go through a concussion clinic. But before they're licensed to fight again, they have to go through a neuropsychological assessment, which I argue is way more expensive than what you're talking about with your services. And often the athletes can't afford it and the promoters pay for it. But the only promotions that will pay for it are Bellator and the UFC. So any of the small local promotions often will not, unless it's a star that's bringing in an athlete that's bringing in a huge number of fans. There may be the occasion there, but in my experience of doing this for, I don't know if it's been 10 years now, but it's been several years, working with the commission, that most athletes cannot afford it, most promoters cannot afford it. And it's the UFC and the Bellator promotions that have paid for neuropsychological assessments. The commission, we set the rules, but we don't pay for any of it. So I think we would be 100% open to looking at better ways for patients who've had multiple concussions in the past to be assessed for safety, for progression in their career. So I think this is a great opportunity. And I know the current commissioner would be very interested in finding more effective ways to help our athletes.
Yeah, because there's been a few times, the show in December, where our main event, he was from Idaho, and he had his MRI came back and it had spots. And the first thing that the commission does when they get his MRI is they actually send it to Faisal. And Faisal's first reaction is, he looks at it because he's so busy. He goes, they need a neurologist to sign off on this to make sure he's fine. So the commission came back to me and said, we need a neurologist to look at this. This guy's in the United States. So I was calling the hospitals in Idaho trying to get this guy in to go see a neurologist. Who the hell knows a neurologist? Like, I don't know a neurologist. Different now, but it's great. But we had to run, like, jump through hoops to try to get this guy cleared because he was flying to Canada in, like, within a week. And when I approached Faisal, I didn't know he had already pushed it off to a neurologist, but I said, Faisal, can you take a look at this guy's MRI? Faisal was like, oh, my son, that's just scar tissue. I would totally have cleared this guy to fight. But always got to exercise on the side of safety. So we see these problems with not having enough information. And luckily enough, I just told him, I go to emergency, bro, and tell them that, you know, you need someone to sign off. And it just so happened there was a neurologist on staff that day. Just so happened he was a huge fight fan, and it worked in our favor. But I'd like to see this something that's implemented in the guys. I'd really like to see that, because it instead of jumping through all these hurdles to try to track down this neurologist, to try to get somebody to sign off to make somebody's clear, at least we can go, hey, here's the map detail of everything. Here's the rehabilitation.
The big problem, Jamie, the interesting problem is I'm not sure sending them to the neurologist is always the best thing, because the neurologist can measure their power and their reflexes and their brainstem reflexes and can give you, but they're not the best at determining if somebody has brain injury. Because you need to do that psychological testing, you need to do that cognitive test to be able to determine that. So even though we do that, it's really for medical legal reasons we do that. Mm-hmm. You know, you've got scar tissue on your brain, you've got to be seen by a neurologist to make sure you don't have any focal neurologic deficits. But those focal deficits, they're really all they're looking for is motor skills. So in order to determine if somebody has cognitive disability or brain damage that's resulting in a difficulty analyzing data or something like that, it's not enough. Mm-hmm. So often, you know, the athletes aren't probably being given the best service. So I think something like this, where you have a way more thorough assessment of more than just that, because as physicians who examine the patients, we can do our neurologic exam for sure, but we can't really do effective timely psychological testing or measurements of cognitive function.
Okay.
Yeah.
Mm-hmm. Now, what was I going to say? I'm sorry, I get distracted because you got to keep your mouth in front of this thing. Sorry. He just gave me the cue, and I just kind of was like, oh, shit. Okay, so how does an athlete get a hold of you? What's the best part? Like, how would be the best way for someone who... What I would like to see is somebody do this prior concussion. Like, I like to see a guy going, "Hey, man, I'm thinking of getting into fighting. I want to compete. I want to do all this stuff." I like to see them do this prior, so that they can do follow-ups to see what their healthy brain looks like before they were smacked around, to and then this is something that they do, whether it's every 6 months or depending how active they are, but something that they continuously go in and see you so that you guys can say, listen, man, like things are changing. Mm-hmm. You're not getting any better, whether they had a concussion or not. So can you see that kind of damage whether he had a concussion?
Do they
have to have a concussion for them to actually come and see you? Could you actually map their brain and say, yeah, you know what, your cognitive function is changing, even though you didn't have a concussion?
Yeah, no. So we measure cognitive function, period, whether or not you've sustained a brain injury or whatever it is. So to answer your question directly, we can test anyone whenever they want. We can test people who just want an annual checkup of their cognitive function. How are they performing? And if they see, oh, maybe I'm falling a little bit behind, what can I do to help improve that? So yeah, to your point, I think it's a great idea. And I would love to have essentially almost any athlete that, that plays a high competitive impact sport, to come in prior to, whether it's actually prior to doing the sport, but prior to like their season, where are they? Where's their baseline? What's their starting point? And, and how are they progressing throughout the years, through injury, through whatever else it may be.
Mm-hmm. So yeah, I had Mozamo Nawaz on, and he's head of a provincial sport organization here in Ontario. And he said the difference between Canadian athletes and international athletes was the science. He said Canada is so far behind. Like if you look at an athlete over, say, in Europe, they're so far ahead of the game because the science is with them. They've taken their athletics to a whole new level of competition because they're putting all their funding into making sure they have programs like this, but it continues. So I'm really, really happy to see this because I want to make sure, me being as a fight promoter, I hold that guilt, right? I go, here I am putting two people in a cage to fight each other until someone's unconscious for everyone's entertainment. But in the end, what kind of results is it going to be in the end? Am I going to make a guy punch drunk? Is it because, do you know what I mean? For really, there's not a lot in return. Like to make it as far as to the UFC, to making those, those $1 million money, it's kind of a pipe dream. It's a lottery. You got to be an outstanding specimen amongst your peers to get on to that next level. So there's people that are going to go through the whole careers and they're not going to get anything out of it. They're going to get the glory of saying that's what they did. Some guys branch off and they open up their own gyms and they do this. It's crazy to me that these guys even do that they will go through that punishment. And Fazo's one of them, right? He's a successful doctor. He's an outstanding citizen in our community. But yet he'll put on a pair of boxing gloves and he'll go in there and he get punched in the head, which I couldn't understand it because I'm not a fighter. I don't have that desire to go in and beat my brain up. So I'm glad this is around and I'm glad this is available for guys, and I hope that they really do take advantage of it. And I hope that it's something that as a community we can work on things for guys who can't afford it to kind of get in. And we're coming back to the cost thing. A lot of fighters are broke. That's the truth of it. These guys coming from poverty. They're coming from. It's the reason why they get into the sport to begin with. You don't get a guy except for Faisal, who's completely healthy, who's has all the things going for them, decides to take it on as sport, something to do. Whereas some guys are so hungry, they're doing this because they need to pay the rent. They need to pay, and they're taking fights that they shouldn't be taking. They're doing unnecessary things because they tend to be a bit wild. So I applaud you for what you guys are doing, and I really, really, really hope we can bridge the gap and we can get this something that's a part of everybody's routine. This is something that they check in the boxes. Okay, you want to be a professional fighter? This is what you should be doing. Take your health serious. Learn your shelf life, because the shelf life isn't very long. So you have like a small window to make it. So what are you doing to make sure that you make it safely and you make it, and you can look at Floyd Mayweather, for example. He's so friggin' with it. Yep. He's never had a concussion in his life. Mm-hmm. He never gets hit. Mm-hmm. Not everybody gets hit. That's what I mean. He's a rare specimen of guys who don't get hit. For the most part, you're going to take your licks. Fazio himself has taken those hits just in training, not even in fighting, just in training, because they spar hard. They go at each other full tilt. So I'm glad you guys are doing what you're doing.
Thank you. Yeah. I was just to add to your point, Jamie, about the baselines. at our office, I personally would love to see an athlete before they actually got hit, because then we can actually take them through not only the Vox Neuro assessment from the cognitive side of things, but we can take them through our baseline concussion testing. So I can actually gather their information when they are healthy. And then if they do get hit, we have a 10-step process that we go through that's pretty grueling by the end of it. They actually have to do what we call the Chicago Blackhawks protocol test, and it's a physical exertion test. I mean, it is brutal. Like sometimes I don't think that I can even pass the test. It's that brutal. So, and I would consider myself healthy. So, we want to make sure that they can go through that whole 10-step process. It's a treadmill test, and then it's the Chicago Blackhawks, and that's the end all to be all to say, you know what? Yeah, you're healthy enough from a physical standpoint to be able to get back and fight. But we also have that information from the objectivity, from the cognitive standpoint, and we can measure. And I love the idea about the longitudinal process, because I can turn around, not only do we see how the athlete's doing, but then it's my accountability. How well am I doing as a practitioner to get that person better? And if I'm not doing better, let's say their concentration was severely deficient, or moderately deficient, and then they become severely deficient, I've done something wrong. So the ownership and the onus is on me then to make sure that I really make sure that athlete gets that much better. Or we have to take a look at other avenues. What possibly what else could be out there that we're missing? And then we go to the places like the neurologist, we go to the psychologist, we do a neuropsych, we do all of these other things. And that's kind of what I was saying about that holistic type of approach. It's not straight lined, it's multifaceted. And I think this is a really great way that not only do we keep the practitioner accountable, we keep the athlete accountable, we keep the coaches accountable, we keep the promoters accountable, we keep the doctor, the other doctors accountable. And it really makes for an excellent start and finish to an athlete where we don't have to pull them. Because I remember that as an athlete myself. I was 21, I had really bad back pain. I went to the doctor, they're like, oh, you need surgery. And I'm like, I'm 21. What do you mean I need back surgery? They're like, well, if you're not going to get it, just consider your career over. Well, that wasn't good. And then the athlete brain kicks in and I'm like, screw you. You have no idea what you're talking about. Here they are.
This happens a lot. This does happen a lot.
This is it. And here I'm then challenging a person who's gone through 12 years of school because they're telling me back surgery. I'm telling them they have no idea what they're talking about. But I had to rehab for 9 months. 9 months before I could get back into it. And I may be one of the fortunate people. I was able to go to Olympic trials in China, but some other people don't. And it's good to know. It's good to know when we have to pull them up. We've had to do that with some of our concussion patients that are cheerleaders. My husband, Scott, works with a huge cheerleading population, and he's had to make that call. And it's a tough call to make when you're an athlete, but then you're also the practitioner. But having that information allows us to make that choice and make that sound choice without kind of blurring the lines a little bit, without having that athlete just chirp to you a little bit more and be like, I'm okay. And you kind of feel it. You feel it as an athlete. You're like, oh, I've been through this. But then your doctor hat goes on and you're like, you shouldn't. And so this way we can turn around and say either, yes, you can continue to go, or no, you may have to pull, or whatever it may be. So I love all of this information. It may just be because I'm kind of a geek at heart, but the more information, I think the better. And then the more informed everybody else is that, that ultimately, we are trying to fight for these athletes so that they are healthy, so that they can continue to fight. And it allows us to do that. From the monetary standpoint, like Kyle was saying, it's all about communication. I know, us in our office, we're not just, it's 650 end all to be all type of thing. Everybody is case dependent. And so, it's just a matter of talking. We're not these slummy type facilities where we're like, nope, we don't care. Don't come into our office at all. We want to work with everybody that comes in. So any way, shape, or form we can help anybody out, especially if they want to get something like this done, we'd be happy to speak to them about it and go from there.
Okay. I wasn't saying that it was too expensive. I was just saying there's a lot of guys in positions that definitely should be in this program, but they just don't have that kind of money. If we can find a certain way, to make it affordable, which would be even better. But like you said, if there's communication is there and everybody has a different story.
Yeah, and I think that's what it is. And communication's key. I mean, we would never be sitting here today unless I, took that leap of faith to be like, oh, I'm going to email someone by the name of Jamie Champion, because MMA fighters have a high prevalence of concussion. If we didn't communicate, we wouldn't be sitting here today talking about something that is so important for this sport. And so I think if you keep the lines of communication open, anything is possible. So whatever works.
Faisal, what do you think the ministry would say on implementing something like this to get it passed as a requirement, maybe to eliminate the original EEG?
Yeah. So right now I'm trying to get the ministry to pay for life-saving medications that people need for their kidney disease or their heart disease, and that's been a hard time. So I think that is a barrier, convincing the Ministry of Health, because really it's what it comes to it is the Ministry of Health reimbursing services like this for patients who have concussions. The commission, really will almost certainly not invest money into this, but the ministry may make the decision, which I would back, that we do a better job managing our fighters who've gone through concussions, and instead of making athletes pay $2,000, whatever it may be, for their neuropsychological testing, why not get a more thorough assessment, a better assessment, for less than half that price? And maybe work with entrepreneurs like these to see if we can get compassionate testing at times. I mean, like you said, keep the communication lines open, right? I mean, so I think that would be certainly of interest to the commission to find better ways of managing.
I think so
athletes.
too. And Luke, who's the commissioner, basically, he's the guy that calls all the shots. He's always looking to change things because it's kind of, I don't want to say it's outdated, but Ontario is super extensive. Like Faisal knows this firsthand. Like sometimes I think it's overkill. Like, I mean, like what are the requirements for an athlete to get? Like,
so you have to have an MRI of your head. You have to have an EEG. You have to have blood work, often within a few months, and you have to have HIV, Hep B, Hep C testing, syphilis testing, which should be removed. You have to have your analysis done. You have to have a full physical done. You have to have an ECG done, and you have to have a chest X-ray. So it's a lot of
that's just to get a license.
And again. That's just to get a license to fight, and then if the blood work expires before your fight, you have to redo it. So there's a lot of the testing needs to be streamlined.
For sure, because you go to the States, they don't go through all that. They don't have to do all that stuff. It's usually just an MRI and blood work, and then they're good to go. So I'd like to see the change in the commission, because this is the biggest hiccup we have in the sport. As a promoter, I'm speaking, right? Because a lot of times you'll match two guys up. Neither guys have got their licenses yet or their medicals in. And this is where they screw it all up. Because there's timelines on the blood work, there's timelines on the CT scan. Everything expires. So if we can go at them with a more direct approach, saying, okay, they went through the Vox Neuro program and Back-In-Action. This is what they're doing on this. And then we present that to the commission and then they accept it. Then they don't have to do all the other bullshit. Like it's... The ways to try to make it easier for the athlete, rather than spending $2,000, like Faisal said, they're only spending $600-700 to for better brain health. So we just have to protect them. But is there a website people can find you on? How would someone get a hold of you?
They can get a hold of me directly. They can also go to the Vox Neuro website. So. Do you want me to give them
www.voxneuro.com? Pretty simple.
And then they can get a hold of us at www.backinaction.ca, or they can email me directly at Dr. Lauren, DRLAUREN, at backinaction.ca. And I've left you some pamphlets too, so if they want any kind of literature.
Yeah, so you can hit me up too, inbox me if you have any questions, and I can redirect people your way, because I'm sure I'm going to get a flood of questions and guys that will definitely be interested in this kind of program. And I'll definitely be pushing it on my end, saying, hey man, like you should check this out. Especially guys who, have had taken those beatings, or, they show definite signs of brain trauma. I like to see them get fixed up.
Yeah, absolutely. And I mean, I can leave my email as well. It's just Kyle@VoxNeuro.com, and very happy for anyone who wants to reach out to me, and I can speak to it as well. But for any of the actual testing that will be conducted will be forwarded over to Dr. Lauren. So
beautiful. Okay.
I just want to ask a quick question.
Yeah.
because we had a bunch of fighters and they talk about having to get CT scans and MRIs, and they don't like, as Dave said, it's like cooking their brain. So what does this process look like? Is it, if somebody's had a bunch of those done, is this like another cook? Like, what is that like?
Yeah, no, it's a great question. So, and correct me if I'm wrong, but CT scans, they use a significant amount of radiation. I think it's between like 10 to 20 years worth of radiation that a human is supposed to endure in their entire lifetime, right? So, what's great about EEG in general is it's completely non-invasive. It's not painful. It is, it's like we said, it's a stress test for your brain, but that's because we're trying to enable your brain to perform as high as it can. But that being said, it's not cooking your brain in any way. But I do totally understand kind of the concern with that. But yeah, with EEG and what we do at Vox Neuro with cognitive health assessments, that's not a concern.
Amazing. Okay, well, thank you guys for coming on. I really, we have nothing else to ask. I think you guys pretty much summed everything up for us, and I truly appreciate you guys coming in. I truly appreciate what you guys do, and thank you so much.
Yeah, no, thank you. No, it was a pleasure to be on here. My first podcast.
Yeah,
nervous,
no, you did great. No, it was good.
It was
it
my
was
first one too.
Yeah.
And thanks, Jamie. Thanks for
Yeah,
everything.
beautiful. Thank you.
Thank you.
I'd like to give a shout out to our newest sponsor, Solutions Today Supplemental Insurance. If you're a competitor in the cage, in the boxing ring, put your body on the line every time you compete, you can get cut, you could break a leg, a finger, who knows, put you out of work. It sucks. They'll provide you with 24/7, 365 days a year supplemental insurance covering everything from hospital stays, fractures, outpatient surgery, recovery benefits, family plans, and more. They pay out in addition to all other insurance, including WSIB, employment insurance, and your work benefits. Qualification is easy. No medical test or exam needed, no occupational restrictions, and no income verification. Head on over to solutionstoday.ca and get coverage for you and your family.